Hello, my name is Pua'auli, and I am a sophomore anthropology and religion major here at West Virginia University. I am working with Dr. Donaldson and her research team on a cultural anthropology project to examine the possible cultural effects on cancer and cancer care in West Virginia. This project examines the cultural impact on perceptions of cancer and cancer care among college-going, college-educated populations in West Virginia, as well as exploring the possibility of pile sorting and ethnographic interviewing as a reasonable way to elicit this information. Most of the time, if you ask someone to tell you a little bit about cancer, they'd be able to give you a list of a few types of cancer and maybe even some treatment options. However, there appears to be a large amount of cancer healthcare disparities in the United States with both knowledge and rates of cancer. To give some background, West Virginians experience suboptimal health outcomes, including above average cancer rates. Previous studies suggest that cultural factors may explain this phenomenon in low-income, uneducated populations. Few studies, however, have examined cancer health literacy among college-going, college-educated populations in West Virginia. And so, this project is designed to explore knowledge and perceptions of cancer among such a population. At this phase in this project, our primary goal is to see if pile sorting and ethnographic interviewing is a reasonable way to elicit this information. This phase of research also contributes to a broader goal of our study, to better understand cultural knowledge and perceptions of cancer and cancer healthcare with the goal of improving patient-doctor communication. The importance of this project stems from the idea that in order to receive treatment in a timely manner and understand the severity of the disease and information given to you by the medical professionals, populations need to be educated on what to look for as well as their treatment options. It is also imperative that we work out any cultural disparities or cultural barriers between patients and doctors so that the patient can get the help that they need. To give more context, generally, most Americans have experienced declining rates in cancer except for the rural Appalachian region, specifically West Virginia. For almost half a century from 1969 to 2011, the rate of cancer declined for all U.S. regions except rural Appalachia. The majority of the United States had much lower cancer rates in 2016 than in 1999, except for many states around the Appalachian region. Even further research has found that West Virginia people are 19.2% more likely to be fatally affected by cancer than someone in an urban region in another part of the U.S. These findings have caused many anthropologists to question the reasoning for such high cancer rates, as well as such great cancer healthcare disparities in West Virginia. To begin our study, we used commonly utilized techniques called pile sorting and ethnographic interviewing. These methods were chosen because anthropologists have determined that pile sorting provides a rapid way to elicit cultural knowledge and perceptions. What has not yet been determined is the effectiveness of this method in a virtual, post-pandemic setting. The pile sorting method uses words and ideas most frequently mentioned in a previous free list exercise to help us organize the information. In this phase of research, we are testing the utility of conducting interviews and collecting pile sorts virtually, using the online tools of Zoom and Flippity. Virtual interviews were conducted via Zoom, and pile sort data was collected by asking participants to organize words and ideas drawn from the free list data in an online program called Flippity. During these interviews, the interviewee is given a set of 30 medical terms related to cancer and cancer treatment, and then asked to sort the terms into piles that they believe go best together. The only rule is that there cannot be 30 piles of one term or one pile of 30 terms. After giving them the directions, the interviewees are given as much time as they need to sort out the piles. After the interviewee has finished sorting the terms into their desired piles, we go through each pile and ask them why they chose those specific terms for that certain pile. Although we are still working on this project, preliminary results suggest that collecting data via virtual pile sorting is a reasonable way to elicit perceptions of cancer and cancer health literacy among college-going, college-educated populations. Hopefully, by understanding more about how people understand cancer, this study will be able to inform doctors about some of the public's misunderstandings of cancer healthcare, so that they will improve the ways they share their information. Ideally, this will allow information to be distributed in a more effective manner in the future. Thank you for listening.